Hello, my name is Shay Swenson, and I'm going to show you how to perform a safe venipuncture. First things first, as you can see, I do not have a tourniquet to use in this process, but as I have been shown as an MA tip is to use a blood pressure cuff when you don't have a tourniquet and to only go up to the 40 mmHg on the scale here for the spirometer. So I will be using that. But the first step that you want to do when trying to perform a venipuncture is you want to first make sure that you explain everything that you're doing to your patient, to the patient, so that they can calm their apprehension and kind of relax their fears. Second thing you want to do is go ahead and insert or put on the tourniquet to be able to see where a good vein would be. So the first things first is find the site that will give the best blood return. So what I will do is go ahead and get this all pumped up and ready. And as you can see, I'm going to pump it up to 40, hold it, and I'm going to go ahead and make a fist with this hand. And what we do is you don't go off of by the site, you have to go off by the touch. So I'm going to take my middle and my ring finger and palpate. The reason why you don't do the index is because it can put too much pressure and go deeper than what you want to find the vein, and so you don't want to mistake it. Now, as you can see, I am pressing in the antecubital area, and that is where you want to do your blood draw. And I am searching on my median cubital vein as well as the basilic vein that is right here. And then I have another one up here on the cephalic, but I can't get to it. But as you can see, I have a really dominant basilic vein. So this would be a really good one that I could draw from, or I could also draw from one that's right in here, then the median cubital. The vein will feel soft and bouncy, as this one does right here. It doesn't feel hard, and if it does feel hard, that's most likely it is a tendon, which can cause lots of pain, so you want to make sure you do not hit it. The other thing you want to make sure that as you look for when looking for a vein is you want to make sure that it is not pulsing. That would be an artery vein, or an artery. And you do not want to take blood from an artery unless, you don't want to take blood from an artery. It can be okay for other tests, but most likely it will kind of ruin the blood test unless it's specified. So with that, since I found a good vein, I would take an alcohol wipe and I would wipe it clean. And then I would get my needle ready. Sorry, I do not have a needle, but I would insert it at a 15 to 30 degree angle. And then I would insert and hold it there. I do not want to move it anywhere, as that can cause pain. I do not want to push in deep insertion, as that can also cause pain too. The main goal with this, is I'm going to release, because if you have your tourniquet on for too long, it can cause the blood to not flow into the arm, which can also cause hemolysis to the blood draw that you are going to be performing, and that can cause false readings for your blood draw. So we want to make sure that we're not always keeping the tourniquet on the patient for too long. If you do end up keeping the tourniquet on for too long and you are no longer feeling a pulse in the radial, from the radial pulse area, or if you see that there's discoloration in the fingers, then you definitely need to loosen up and switch to a different arm, or allow your arm to rest and allow blood flow to continue through the arm for the next 2 minutes. Last but not least, if you are unable to perform a safe venipuncture after 2 attempts, do not try again for the 3rd attempt. Go and get another healthcare provider who can be able to help out, just so that there's less anxiety with the patient, but not only that, not to ruin the supply for the lab that you need. So I hope this makes sense, and I hope all of this works out. But yeah, thanks so much.